Hello, good evening. Hi. We're waiting for Dr. Shilpi to join us. Once she's here, we'll start our talk right away. It's not going to be a very long talk. It's going to be maybe for half an hour. That's an extremely important topic. Am I not audible? Am I not audible to anybody? Am I audible now? Can someone leave a text? Yeah, thank you. So meanwhile, if you have any questions about postpartum depression is depression seen immediately after childbirth in a woman. So if you know anyone who's going through this, or if you yourself went through this, you please feel free to leave a text, and me and Dr. Shilpi will be able to, help you with the queries. Hello, give me 1 second. I'll quickly get in touch with Dr. Shilpi. Yeah, hi. Reason for maternal depression. Yeah, we'll be discussing about that. There are a whole lot of reasons, including hormonal dysregulation and many other things. We'll be talking about that now. If you also want me to talk about any other uh, important topics, please feel free to leave a text here, or as a comment to any of the picture. You can do that. I'll be able to check. Unfortunately, I don't really check my direct messages because of the busy day.
Hi, everybody. This is Dr. Shilpi Reddy.
Hi, ma'am.
Hi, Shilpi.
How are you?
Good. Busy day, as,
Busy
as
day. Yeah,
usual.
I'm sure. I'm sure. Ma'am, introduce yourself, ma'am. Tell people what do you do, where you're working.
Yeah. I'm Dr. Shilpi Reddy. I'm head of the department, Kim's Cuddles Mother and Child Center. We run a 25-bedded luxury labor and birthing center exclusively into prenatal interests of pregnant women, making it more possible and likely to have a natural birthing. That's our specialty. We also do deal with high-end infertility pregnancies and high-risk pregnancy care, because Kim's is known for a comprehensive healthcare setup. So we do all kinds of high-risk pregnancies where a lot of maternal and fetal risk factors are dealt on a day-to-day basis, and we are specialized in giving very good outcomes even to the baddest of bad pregnancy. We make their journey beautiful with our day-to-day management and lifestyle skills what they teach them. So that is our specialty in cuddles.
Yeah. I mean, everybody should know that Kim's Cuddles is primarily a maternal and childcare center. Then all of us got added along to the.
No. Definitely, we have added on to the comprehensive healthcare of Kim's panel. So that's an advantage that we've got through, rather than, the other departments getting an edge over us. It's because of the other departments we have an edge over in managing high risk pregnancies.
Yeah, that's right. Ma'am, firstly, I chose this topic because the prevalence of these cases are really increasing, um,
Yes.
especially in
Uh,
COVID.
Yes, in COVID also. See, pretty much we moved from past 3 generations. If you look down now, there's a lot more of nuclear families that
Yeah.
is there. There's a lot more of displacement of families from north to south and south to north and east to west, all these places. So basically, people are not living in their biologically friendly environment. They are displacing themselves for better opportunities, better quality of life, to different locations. And where they get settled,
Mm.
what they lack is family support.
Yeah.
What they lack is the nucleus that which they have in the form of their relatives or friends or whatever said and done. They lack those kind of very close people who give that cushioning effect in life, and they become extremely lonely. And all of a sudden, pregnancy, childcare, and all these things bring a huge, responsibility kind of thing, and they get confused. In that confusion, adds on to the Google information, what they get free of cost. They think everything is like a, say, disease.
Mm.
Why do we Google things? We
Yeah.
give a symptom and we find a solution. Pregnancy is not a disease. It's a biological phenomena, which has to be enjoyed as a phase of life, and it's part of your, family, your culture, your legacy. There's so many things associated with pregnancy, and it's a joyous time, and it's very precious for everybody because it's going to get their newborn into their life, and make people dream about pregnancies and all that. So with all these situations, they end up lonely, they
Yeah.
end up in a new place, and they don't pretty much get the kind of comfort from the situation that they are in, and lots of unwanted information going all around their heads. They think that maybe they're not very comfortable, or every step they feel they get so guarded.
Yeah.
Is it right or not? Is it right or not? So
Yeah.
there's a lot more of confusion added to it.
Also, not just the family, ma'am, even the interpersonal relation between the husband and wife is also somewhere ruffled in these days. So that is also adding.
Yes, because the number of hours that they spend with each other.
Mm.
If you talk about few years back, of maybe 20 years back, there were specific work timings,
Mm.
like either it was agriculture or it was some manual labor or anything. All works in the daylight,
Mm.
and once there's sunset, you get back to your family,
Yeah.
and your family is the only entertainment 20 years back, wherein husband, wife sit down, talk, neighbors sit down, talk, children, they sit down and talk, the elders in the house who sit down and discuss good, bad about the day schedules and all that. But now, if you see, there's a lot of change. There is an extended working hour that is there. There is definitely a time that goes for commuting.
Yeah.
There is definitely a time that goes on social media. There is definitely a time that goes for preparation of meals and all that. And there are so many other things
Yeah.
preoccupied in life. So every person has their own schedule and what to do in that schedule. When it comes to interpersonal relationships, they either speak 10 minutes over dinner time if it is same, or 15 minutes
Yeah.
or half an hour. And personally, they're not trying to gel in each other's life. If they talk more about each other, they feel that they're interfering. Why are you
Yeah.
cross questioning? Why are you asking this? It's very, different kind of a thing.
Yeah.
So if there's no adequate time that they spend with each other, how would that chemistry be?
Yeah.
Hardly any chemistry to talk about. So
Yeah.
this is also causing a lot of problems these days. And suddenly, when a responsibility comes and you talk to each other, it's sometimes leading only to fights, because there comes a difference of
Mm.
opinion. So you get information from
Yeah.
different people, you get different information which does not match. And what I still
Yeah.
feel is you should take the help of doctors and go by one person, so that if husband and wife are told at the same time by the same person, so that there is no difference of opinion.
Yeah. 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 Also, they shouldn't listen
And
to like he said, she said, and that family member said, my mother said like that.
anybody and everybody gives advice.
Yeah.
Yes, still now we see people, great grandmother asking them to have gond ke laddu, and they don't even know where gond is found. So this fellow says there's a pretty much a petty fight. The husband says,
Yeah.
my
Yeah.
grandmother has told you to eat gold ke laddu. This female says, where do I go find gold now? How do I make the laddu? I'm here and you give advice and I have to do all these things. There comes a fight. So there are pretty much small things that lead to commotions, and they sit in either your clinic or my clinic discussing these things.
Yeah. Also, ma'am,
So,
I mean, the new mothers, especially the primees, are almost made to are shamed by their spouses that you can't even take care how capable of mother you're going to be. Listen to my mother. That kind of connection also is
exactly.
seen.
Exactly. That happens when the spouse is not trained properly with
Mm.
parallel to the pregnant woman. So here at Cuddles, we are very much interested in treating both partners to be pregnant, and anything that is related to pregnancy, leave alone the medical checkups. Other than medical checkups, also what to eat, what not to eat, how to prepare food, what is the role of the husband, what is the role of the nutrition in this time, because when grandmothers and mothers were pregnant, they were around 35 to 40 kgs of weight.
Yeah.
Now we don't find anybody of that weight to eat that amount of calories and that amount of diet and nutritious diet.
Yeah.
And they were in their 16 or 18 or 12 or whatever years.
Yeah.
They were quite young when their growth was there, their potential of growth was there, and the kind of food that they need to eat at that point of time was to support their growth, their pregnancy growth, and if the mother is feeding another child, that also. So
Yeah.
we don't get such situations at all. Anybody who's pregnant now is definitely above 50 kgs.
Mm.
They're 70, 80, 90, 100 kg also. They just can't eat like their mother and grandmother what they used to eat.
Yeah.
So definitely we have to train the husband not to listen to people
Yeah.
with an irrelevant clock.
Yeah. Yeah.
So you have to train the husband. So that is what happens at Cuddles.
Mm.
We have prenatal classes wherein we teach them particularly how to support your wife physically, mentally, emotionally, because health is just not a state of
Yeah.
absence of an disease or infirmity.
Yeah.
It is physical, mental, and social well-being, and now even more spiritual well-being.
Mm.
That's very important. You cannot forget that fact. And keeping husband and wife in the same line is really more important to fight problems like postpartum depression.
Mm.
Because these things take a toll on women's life and they change 360 degrees her basic character and virtue,
Yeah.
which is associated with her at the time that she has to spend with the child, emotionally connected and enjoy parenthood. She gets into unnecessary things like, peripartum depression, postpartum depression. She loses that golden opportunity and moments of life. She spends that time in grief and crying and all that. That's not right.
Yeah.
That you should really incorporate men and the family members into the right thing that is needed at this point of time. If they are very well in a joint family, yes, you can train the mother-in-law, train the mother, because all that the doctor needs is to speak to a group of people.
Yeah.
To send one good message.
Yeah.
So we have to prepare the family, whether it is nuclear family, whether it is a joint family. We have to prepare the family in such a way that no injustice is done, basically.
Also, readiness of both the partners to have a child is very important, ma'am, because usually men and men's family dictates when women should have child. I'm not generalizing, but that's also a pattern. That's also extremely important.
That's a point that they make. That's a very vivid statement that they make, and they want it to happen at whatever time possible that they are deciding. And that is not in the generation now women are in, because they also have put equal efforts in doing their education. They are also they've also put efforts in putting up their career. They also have phases where they have to think about their career and growth, and that is when they have to follow their ambitions. Yes, that is the reason why nowadays even certain companies are funding oocyte retrieval and freezing of embryos, so that even if you are going behind chasing your dreams, you can have always a healthy embryo that is there stored for you whenever you are ready for parenthood. Yes, women have their goals, they have to achieve their goals, but yes, they definitely have to balance things, and they can't say when they're 36 or 37 that I'll take 4 more years to have a child. So that's also not correct. So they have to balance things. When they are young, it is easier to grow a child and take care of the child
Yeah.
because you're physically fit. When you're 35, 38, 39, 40, you're not physically fit. You're into some kind of issues here, there, obesity, something or the other. They even complicate pregnancies. So women should balance things.
Yeah.
That is one thing. And men should understand the career growth of women and they should respect their uh, ideas, and it should be mutual.
Yeah.
Rather than families into it, yes, it should be mutual. And families also will be happy if these two are happy.
Yeah. Also,
Couples happiness is over anything else.
yeah. Yeah.
Yes.
I mean, also, I think the belongingness. A lot of people who come to my OPD, they say that it's my child. I know how to take care. I said it's not your child. It's both of your child together.
No, child is a child. It belongs to the family.
Yeah.
Be it the mother, father, grandparents, aunts, uncles, anybody.
Yeah.
So child is a child. A child needs nourishment from all relationships.
Yeah.
And this is what we have to teach the current generation. And this is what the current generation is lacking in. They feel they are an entity by themselves, but it's not that.
Yeah.
They belong to the society, they belong to the family, they belong to the country. So there is nothing called I. It's always we. And we succeeds better than I.
Yeah.
And it's more of a security also.
The
interpersonal relationships definitely it's directly proportional to the mental health.
Yeah.
The more interpersonal relationships are good, the more love and emotional support that you get, the less likely you will have any, psychological or psychiatric or any other issues that come along with lifestyle.
True.
So family bonding is definitely the need of the hour. And I'm a strong believer in joint families, basically, wherein kids get the love of grandparents, aunts, uncles. And especially nowadays, when most of the young generations have gone outside India, there are hardly people left over here to call them as relatives or close friends. But then now friends have also become like extended family.
Yeah.
Whosoever it is, they should give that love and support.
Yeah.
Rather than, cribbing and giving opinions,
Yeah.
unnecessary opinions.
They say no, man.
They should try to spread love.
Yeah. They say that it takes a village to raise a child. You can't just do it.
Yes, definitely.
Also, the problem with a lot of this generation mothers are that they don't ask for help. They feel like,
Yes.
I'm an independent woman, so I can do this by yourself.
Yeah. Google says that. Google says that you can raise the child with these 10 commandments or
10 steps.
You do these 10 things and your child will be yours and they will be raised properly. It's not that way.
Yeah.
It's definitely not that way. And child rearing is an art in itself, and nobody is 100% perfect in it. And every day is learning. Every day is learning.
Yeah.
And every person that adds on to the family's values and all that, it helps a lot. It helps build a soul that is growing.
Yeah.
And you need that healthy soul and that growth for a very good futuristic nation, because today's children are tomorrow's whatever future that we see.
Yeah.
So it's our responsibility to grow them in that potential that they are mentally healthy.
Yeah, true, ma'am. Ma'am, talking a little bit about the hormones, which leads to postpartum depression. What do you think happens there? Why some women undergo postpartum depression and some don't, in spite of having good family support? Is there a biological basis?
What happens is it's definitely a play of hormones.
Yeah.
When your estrogen, your progesterones are balanced and pregnancy comes and there's a lot of progesterone in the body, the HCG hormone comes in, and your body hormones, there is every day there is change of the structure of the body, the physiological organs, the hormones, the blood supply, everything changes. So when there are changes coming in your body, there is definitely a play of hormones. And depending on the emotional condition that you are in that phase, if you're emotionally labile, if you're emotionally stable, you can go through it as a phase. Yeah. You know how to control it, you know what to do, you know how to exercise, you know how to make your dietary changes, you know what to do, how to do your time. You can listen to music, you can listen to Garb Sanskar music, you can read nice books, you can watch nice movies, or something like that. So they know how to stabilize themselves. But there are certain people with, emotionally labile conditions where they have that loneliness inside them. Maybe some amount of things that they come from their childhood, or an emotional thing that has happened in their life, an after expression of certain things, that they question themselves and they find answers in themselves. And in such people, when an emotional condition comes in, they either break out and they feel lonely, and that slowly adds on to the physical changes that they feel, and the dialogues that come from their partner or in-laws, somebody. It can be mother also at times. Just look at you. You're not maintaining your weight. You're gorging on food, or you're not eating at all. Some kind of that trigger.
Conflicting
Anything
message.
that triggers. Anything that triggers, they go through that. It adds on to it. That adds on to it, and it goes again into the next level. So in such people, these kind of emotional disturbances with an added phenomenon of triggers and physical structural changes, over on top of that, they get these what do you call, responsibilities. The new responsibilities that come with child rearing, the new mothers who have to take care of the feeding, every 2 hours feeding. They say that, am I a cow? What is my life? Every 2 hours I have to feed the baby or change the nappies, or this has become my daily routine. I don't have sleep. Any person who does not sleep, who's having good sleep, does not sleep, they are definitely subjecting their mental status to a trigger. So all these things are trigger factors for postpartum and peripartum depression. And you just can't treat one thing, one. It's that you have to treat it as a whole phenomena together. First, you have to give her a rest, somebody to take care. When the baby is sleeping, the mother should also sleep. Somebody to help her, even the husband, by changing diapers or taking care of the baby, or making the baby sleep, or changing the clothes, or getting the clothes, into the machine to be washed, or getting some healthy meals for the mother, giving her hydration at times. And when the baby is cranky in the night, to take care of the baby. These small things. And if they are living with family, they take care of their diet and give her some rest and console her, and share her their experiences, and they tell her that eventually it's a phase of life. And loving husband, tender loving care, whatever matters, tender loving care you give the pregnant woman, definitely there are less likelihood of chances that she might lead into a peripartum or postpartum depression. Even the healthiest of people, the best and best of tender loving care given husbands, also can lead to peripartum depression, because if there is an emotional insult that has happened in their past, or that they're carrying in their brain, or a subconscious insult that has happened, they also come out. So that needs therapy, definitely. So we just have to figure out what it is. And correction should be 360 degrees. Not only medications, not only just emotional support or just some nanny support or anything. It should be 360 degrees, and that's how things work very well.
Also, some people have the feelings of entrapment. They feel the loss of freedom. That, okay, now that I have a child, my life is not mine anymore. It's all about the baby, or I'm not. Also, the body image issues. Maybe I'm not looking as fit and fabulous, or these kind of body image issues can lead.
And to break this monotony, we have come up with Mrs. Mom event, wherein we make pregnant women beautiful, look beautiful, feel beautiful, and exactly celebrate motherhood. In fact, teach them everything about motherhood in that 1 week, classes, workshops, diet, husband training, everything. And we make them walk the ramp and show them they are divas and nothing less than divas. And pregnancy is a time that they look the best, gorgeous. Only that people don't appreciate them. Because people are also blinded by that. What motion, I don't know. But people feel that, I still don't know why people feel like that, but pregnancy is the most beautiful phase of life, which every pregnant woman should enjoy.
True. For everybody who is not understanding what ma'am is saying about, this is Mrs. Mom competition that takes part every year, no ma'am? This is every year.
Every year, annual event.
Annual event from Kim's Cuddles. So this is going to happen in the next coming week.
Yes.
Yeah, this will definitely help for the confidence of mothers and a way to celebrate mothers. Not just
One of our main thing that we are fighting is maternal stress,
yeah,
kill maternal stress, and the main thing that we are fighting with is peripartum and postpartum depression.
yeah,
Say no to depression, say no to mental illness, and make a beautiful pregnancy memories.
yeah,
Definitely, you will have a natural, normal delivery.
yeah,
Because all these events that we have run through years, this is
yeah,
the fourth season that we're doing, they have definitely given very good results in terms of having a natural birthing and also a very good emotional support from the family, from the husband, and overall a beautiful pregnancy experience.
yeah, yeah. That sounds great, ma'am. So we discussed pretty much about risk factors, causes, and how to prevent extensively. Um, one more thing I want to say from my side, ma'am. A lot of women think that, oh, if I go to psychiatrist, he'll give me medicines and my baby will get affected, right? Medicines is,
Absolutely not.
yeah,
It is over the years proven, there's no doubt about it.
yeah,
Many international studies have claimed that if anybody is going through depression, not treating it is more harmful than treating it.
yeah,
And it is especially going to be self-destructive if you don't take help.
yeah,
You should take help at the earliest.
yeah,
What have international, acclaimed people, why have they come forward and talked about depression is you should express your feelings to a person, the right person, this
yeah,
right person, if it is a psychotherapist, psychiatrist, anybody that helps mental support, you have to take support. They are the right persons to deal with either it is going to be counseling or that it is going to be therapy, the right amount of medication, which will definitely be stabilized in your phase of pregnancy and post delivery.
yeah,
Medicine has to be taken if necessary,
yeah,
and that is to prevent the hazardous effects of
yeah,
this peripartum depression, postpartum depression.
yeah,
People are self-inflicting them with pain by not going to the psychiatrist.
yeah,
They have to go and they have to reach out for help.
yeah.
The earlier that they reach out for help,
Hmm.
the easier the treatment becomes, and they come back to life so easily and they enjoy parenthood. That's
Hmm.
very, very important, and it's a very good take-home message that
Message.
depression, signs and symptoms, any excessive crying, any excessive emotional feelings,
Yeah,
sleeplessness, or retracted phase, not talking to people,
yeah,
or self-inflicting wounds,
yeah,
or not eating, or any eating disorder, overeating or undereating,
yeah,
or loss of weight or fast gaining weight, anything, you have to take help.
yeah, yeah,
Please try to understand. We are fighting with something which is not known. We are fighting with ourselves
yeah,
inside us.
yeah, yeah,
It is difficult at times for the opposite person to understand.
yeah,
And the level of, problem cannot be understood by a person next to you, be it your spouse also.
yeah,
So better that you take help of the concerned specialist who is going to advise you
yeah.
and who's going to get back your smile on your face. That's more important. It's not just living anyway, it's
Yeah.
the quality of living
Quality,
that
not the
you
quantity.
should
Yeah,
think about.
yeah,
Yeah, it is never about the quantity, it's about the quality of life.
yeah,
Extremely, every single day is important. Every single day, you should feel that you're doing something good for yourself, because that day passes, you're going to not get that day back. So, definitely think good, feel good, extreme, extreme joyous time of life. Don't waste on any, be it a physical problem or a mental problem, don't waste time on it.
yeah,
You should take help. That's what I suggest.
yeah. Thank you so much, ma'am. I mean, you came at a short notice in spite of being busy with the whole Mrs. Mom competition as well. Um, uh, Thank you so much. I hope people take home this message of how family support and the cushioning, emotional
Yes,
cushioning is very, very,
yes,
very important.
yes.
And it's okay to take help
At
from your
least
family.
don't treat psychiatric problems as a taboo. It's gone are the days
Yeah, yeah, yeah.
when psychiatric problems are a taboo. There's no more taboo. It's just about mental health is equally important, and that is the only thing that can keep you 100% healthy.
Yeah, yeah,
Health is not about absence of physical deformity or infirmity. It's
yeah.
emotional and spiritual well-being
Well,
also. That's very, very important
sure,
to it.
sure. Thank you so much, ma'am. You have a good night. I'll see you in the hospital. Bye.
Definitely. Bye. Thank you.
Yeah.
Keep fine.
You too, ma'am. Bye.
Yeah. Bye.
So I'll quickly take a couple of questions. Somebody is saying, how about postpartum depression? Does it exist? Your grandmother says it's all drama. No, it is not. Tell your grandmother that if she understands what I'm saying, there are bodies run by hormones, brain is run by neurotransmitters. The hormones and neurotransmitters, they interact with each other for a proper functioning of brain and body, or mind versus mind and body. So during pregnancy, your estrogen progesterone levels are twice the normal amount, right? That's how your pregnancy is maintained through the 9 months or how many ever months you're pregnant. Now, this estrogen progesterone levels, they regulate the secretion of something called serotonin in brain. Serotonin is a hormone that keeps us happy, active, alert, our energy levels are intact, our sleep is good and everything. So when your hormone levels increase in the pregnancy and they suddenly go down once the baby is delivered, sometimes the levels fall below the normal baseline. That's when your serotonin levels also get affected, directly proportional to the estrogen loss. That can lead to depression. Also, other hormones called thyroxine, prolactin, oxytocin, cortisol. There are various other hormones that are dysregulated, like Dr. Shilpi was telling, emotional dysregulation and hormonal dysregulation leads to postpartum depression. Don't be angry at your grandmother for saying it's all drama. Maybe she doesn't know any better. So even if she listens to us speaking, probably understands what doctor is saying, maybe she will see a point. I hope that question is answered. Somebody saying I suffer with childhood depression. Reason for my problem: my parents are consanguineous marriage. I think that limited information is not enough. Please get a consultation with me or any other psychiatrist close by. You'll be able to be helped better. Yes, but consanguineous marriage is definitely one of the risk factors for mental and neurological problems. Yes. Yeah, I think that's pretty much. And one last question, which we forgot to address, is there are two different conditions called postpartum blues and postpartum depression. Postpartum blues are seen in 80% of pregnant women. So out of 10 pregnant women, 8 of them can have it, where they're having low mood, irritability, mood swings, and not able to sleep. If this is staying, these symptoms are staying with you for a period of 3 days to 10 days or one maximum 2 weeks, it is okay. You don't need medications. You just need reassurance, probably by a counselor or maybe from your family members. This baby blues will be resolved. But 20% of the people with baby blues can turn into postpartum depression. That is, out of 10, let's just say 2 of them can have postpartum depression, where the symptoms, as Dr. Shilpi was telling before, are loss of mood, as in low mood, no interest to do anything, lethargic, sleep disturbances, appetite disturbances, sex drive problem, not able to focus, or being very sensitive, emotionally very labile, being very cranky or irritable. All these symptoms, if they're occurring beyond 2 weeks, along with suicidal intent, and sometimes even these thoughts to harm the baby or harm yourself, please don't judge yourself. Don't start thinking you're a horrible mother or anything like that. Please come and see a doctor. There could be something more than your character. Maybe it is a disease. We'll have to sort it out. It's very important. Also, there's something called as postpartum depression in fathers as well, because especially if he is the bread earner of the family, he will have more added responsibility in terms of financial responsibility, and maybe he's not prepared enough for it, or maybe he underestimated it. Maybe he's overwhelmed by it. That can also cause depressive symptoms in father, but not as much as mother. But even men should be able to understand following delivery, if their mood is low as well, it's okay to come and see a doctor once. Someone asked a question: if I don't feel bonded with my family or attached to if I don't feel bonded with my baby or attached to my baby, does it make me a horrible mother? No, it doesn't make you a horrible mother. If you're not feeling bonding or if you're not feeling attached, it's okay. This is a very common feeling, common complaint that a lot of people, a lot of new mothers go through. please see a doctor. We'll be able to help you for sure. Also, rooming in is very important. Rooming in is when you're not able to identify with the baby or not able to bond with the baby, try to physically have skin to skin contact with baby for a lot of time, because the research says that skin to skin contact, or we call it rooming in medicine, that will evoke a lot of positive feelings towards the child well-being. Also, it secretes endorphins in you and oxytocin in you, which is definitely important for your emotional well-being. So you will start enjoying your motherhood and baby. One more important risk factor is a conflicting thought that that your mother didn't take care of you well, so what if I don't take care of my own child? These kind of thoughts have to be helped by a doctor, because probably you already had depression even before, or a childhood depression that is coming back in full bounds following your delivery. So don't neglect help. Please come and see a doctor. It's not a big deal at all. In KIMS, I see pregnant women all the time. Dr. Shilpi and all the other gynecologists, they keep referring to me. Also, don't think like I'll give medicines. Even if medicines are required, I will give you and I will convince you why you should take it. And I'll also help you with the breastfeeding, how the medication goes into the breast milk and how many hours later you can feed the baby. So your baby is absolutely 100% safe and the drug doesn't go into your baby. Untreated depression damages your health and your child health more than treated depression. It's a big battle. You can't do it alone. It's okay to take help. That doesn't make you a dependent woman or a weak woman. It only makes you a stronger person, stronger woman. So say yes to life, like doctor was telling before. Any other questions? I think we pretty much covered everything. Yeah. Thank you. I'm glad it's helpful for you. Psychotherapy is helpful, sir. Dr. Pramipexole, first, I think you have to come and see a doctor. See, over direct messages, over comment section, you really can't get treated. You should understand more than anyone else that it requires thorough evaluation of at least 20 minutes to half an hour. If you ask me 3-4 questions, that's not going to help me understand what you're going through. So my advice henceforth won't be right. So you can see me or anyone else close by. A lot of us are available online as well. What do you think about adult ADHD? I'm following CBT and would taking medications help? Oh, adult ADHD medications are definitely one of the mainstay of the treatment, and therapy also should be done equally. So it's not like either medications or therapy, but I think strictly today we will stick to postpartum depression topic. ADHD is something that I'll be talking soon, probably next month, and probably able to help you. But yes, adult ADHD medications are important. A lot of adult ADHD patients self-medicate with cannabis, or ganja, or alcohol or smoking, so that calms them down and make them concentrate better. That way you cope with adult ADHD. Please seek help. Please see a doctor. I think that's pretty much covered all our queries. Tune in next Wednesday. We're having another interesting topic with another specialist. Before that, my consultation hospital, I work at KIMS Hospitals. Timings is on appointment basis. Please Google the number and call and take the appointment. Also, thank you so much. All of you take care and stay safe. Okay, one last question I'll take. Full form of ADHD and CBT. ADHD is attention deficit hyperactivity disorder. CBT is cognitive behavioral therapy. I hope that's answered. Thank you, all of you. Stay safe. Take care. Bye.